Hey everybody, thank you for the opportunity to be a part of this dialogue on family planning. I personally, and I think World Vision, we're excited to be part of the dialogue and the conversation around what does it mean and what are we learning about best practices in engaging faith communities for healthy timing and spacing of pregnancies. And I'm going to speak specifically today about our Channels of Hope program. So first, I know I'm speaking a little bit to the choir here, but why even engage faith leaders in the first place? I think for us as an organization, the church is we see the church as our indispensable partner, and other faith leaders and faith actors as primary advocates for change towards child well-being in our community. And the role of the church and us as Christians is really to demonstrate the love of God, to love others, to love God, to love others. And one of the ways that we can do that is really to help our communities be healthier. I live in Seattle. It's easy to think that the role and influence of faith leaders is really waning, depending on where we live in the world. But it's not true. When you look actually at the global picture, faith leaders are incredibly influential. People increasingly are people of faith. The number of atheists and agnostics in the world is actually decreased dramatically. And especially the major religions, Christianity and Islam are growing incredibly quickly. The Pew Research shows that by 2050, 64%, almost 2/3 of the world, will be Christian or Muslim. So engaging those populations in the work that we do is essential. And in Africa in particular, 74% of people surveyed say they trust faith leaders the most. So ensuring that we're working with and advocating with faith leaders is important. So what is Channels of Hope? Channels of Hope is a methodology that was developed in response to the HIV crisis in South Africa, kind of over time. And it's a unique blend of technical information, a scripturally based faith response, and engagement with other community actors. So understanding that faith leaders and faith communities, they're part of a broader system, and they have the opportunity to really sensitize, mobilize, and engage their communities for action. After HIV, faith leaders started to say, okay, we're having issues also negotiating gender in our communities, child protection, maternal newborn child health, and Ebola. And so since then, it's new curriculums have developed. The key kind of the way that it works in the community, we understand that every community has identified a wide range of issues, challenges that they're facing. The government is active, this is a simple picture of the actors, but you've got NGOs active, you've got community-based organizations active, and government's coming with their systems, their services, their key messages, policies that govern health systems. Similarly, NGOs come, they have their key messages, they have their approaches and their models, and they're all kind of coming into these communities, trying to work with the community to address these challenges. But you also have really key actors in the community, these are faith leaders, among others, who can be barriers. And a lot of that can be because of lack of information, lack of knowledge, particular theological or scriptural understandings. And what we find is they often stop the progress. They're reinforcing, or their views are reinforced by cultural, religious, or economic practices that have been meaningful in their communities for years. And the way that the messages come to them are not received in a way that they can then continue to go into the community and repeat those messages, they feel like, with integrity. So what we find is when we come in with Channels of Hope, the kind of that unique blend of approaching scripture and saying, what does scripture have to say to this? What are your scriptures actually, what do they say about children? What do they say about, what does be fruitful and multiply mean? Yeah, when you read it, and how do we sort of unpack that in our world, along with accurate scientific information about health, and finally really connecting them with the other actors in the community to see what's already happening and how can we engage. We see they become some of our greatest advocates. They become voices for change to speak into those cultural and religious practices, and then you see child well-being outcomes. And some of the key outcomes that we look for are maternal newborn child health. It's a broad package, but one of the probably top 4 things, or the key 4 things that we're looking for is to talk about healthy timing and spacing of pregnancies, as well as male involvement. All children are celebrated regardless of the circumstances of their conception, and improved access and utilization of health services. So we're gonna do a little deeper dive into a particular project in Kenya, the Moment Project, that Channels of Hope is one of the components. So there's work with the Ministry of Health. There's work in ensuring that family planning methods are available in local clinics, among other things. I'm going to speak specifically about the faith leader engagement. So Channels of Hope starts with a workshop for faith leaders and their spouses. And there's kind of 3 main aspects of it. One is that head part, really learning the basic technical information. The second is really touching the heart. So engaging their faith perspective, helping faith leaders understand the impact of the issues through personal testimonies and stories. And then finally, again, equipping with practical tools and opportunities to engage with other actors. Key messages around healthy timing and spacing are simple. You could see them. There's also, along with that, is something that we find incredibly important for faith leaders is understanding how the different methods of contraception work. Because there's often huge misconceptions and barriers with faith leaders about just the term family planning can be sort of a deal breaker in some of the communities where we work, because they equate it. We had one pastor tell us that they thought family planning was killing children. I mean, it's simple, but this was a view across the county in Kenya. And for them, understanding how the technical information and the scientific information, how it worked, helped them see, oh, this is not actually what we thought it was. This is something that we need to engage in as faith leaders. The second aspect, touching the heart. Again, the personal testimonies are huge. People may share an experience of a miscarriage or an experience that they had because they were having children too often and they couldn't feed all of their children, and they were running into challenges with that. And then it opens up the floor, and faith leaders are sharing stories of their own experience or even their own families and what it has meant in their lives. And then they're encouraged to wrestle through these really intentionally controversial statements. So just as the first example on here, birth spacing is wrong because God intends and creates pregnancy, and it's not our role to play God. And faith leaders are encouraged to kind of think it through and argue, essentially, discuss, dialogue with each other about what do we think about this? Is this true? Do we believe this? Do we not believe this? What does Scripture have to say about this? And through that sustained dialogue, there's great opportunities and sort of aha moments about what it means to love our families, to love the families in our community, and how we can best do that based on what we've learned kind of about the technical information. So Pastor Fenwell is a good example. I think he has 6 kids already when he came to the training, and he basically repeated what that question said, right? We believe that reproduction and giving birth belong to God, and no man should interfere. And he quoted Scripture to support that. And through the course of the Channels of Hope process, his views changed. Now he's a huge champion and promoter in his community. And then finally, just that equipping the hands part. So giving the faith leaders practical tools that they can go out and start acting immediately, whether it's through referring people to family planning services or talking about family planning in their sermons. We see an increase in that. We did a study this is actually in Zimbabwe, trying to get at, from a qualitative perspective, what is it that helps faith leaders kind of change their attitudes and perspectives on this? And they highlighted, we did this with a university in the Netherlands, the University of Groningen, and kind of through a number of key informant interviews and focus group discussions, they said, okay, what's coming up again and again is that faith leaders are saying engaging the scripture and sacred text is essential. Number two, that time of well-facilitated and sustained dialogue to really like in a group setting, talk about what we believe, why we believe it, and consider our views. That's essential. So the tough stuff questions, it's a key way that they do that. And then finally, just the personal, emotional, and spiritual impact, whether it was actually through the sessions itself or as they were reflecting personally after the training or in the evenings or over dinner conversations, they felt touched by God, as well as the stories that they heard. So Reverend Gabriel says that it's the faith focus on birth spacing that was new to him. So there have been a lot of actors in their community who really had, hit the healthy timing and spacing of pregnancy messages, but they'd never been able to receive them before because of the way that they had been packaged. So after faith leaders are trained, they then go back to their communities and get their worker bees. We call them community hope action teams or chats. And so the people who are actually going to take the work forward, 4 or 6 come back, they basically go through the same process that the faith leaders did and develop action plans that they share with the group, and they come back a couple times a year and they show how they're doing, give updates, share what they've learned and ways that they can better collaborate with the group. And then from there, it goes to the whole community. So there's so many examples because faith leaders and faith communities take what they've learned in so many different directions. Some immediately start incorporating sexual and reproductive health information into their youth clubs. Some pastors start preaching about it every other week. Others, this woman here, Pauline, started to literally go door to door and share the information that she learned with everyone. And Rose, the taller woman actually, has started practicing family planning because this woman came to her door and knocked. So faith leaders incorporate healthy timing and spacing messages and referrals into their premarital counseling. There's so many different ways that they're kind of understanding their role, or advocacy campaigns to ensure that they have they have family planning in modern methods of contraception in their local health facilities if they're not available. So in this particular project, 200 faith leaders were trained last year, 360 volunteers were mobilized, and as a result, more than 4,000 women were referred to family planning services, and over half are using a modern method of family planning. So there's the breakdown. This is a quote from a public health nurse. The moment is effective because it brings together all the stakeholders, faith-based organizations, churches, community health workers who are creating the demand. And when people come for family planning, they're available. The things that they need are available. And she's asking for the program to expand. So we're in a process of learning. We're continuing to learn. Something we're really excited about is we're doing an operational research project sponsored by the Templeton Foundation in Ghana and Kenya, looking at the role of faith communities and faith leaders in particular. And actually, the key questions are both how are they delivering the messages, and does it actually lead to change in attitudes of the faith leaders, and then finally to actual stronger uptake of family planning. Thanks.